So we have 3 children. Chris was the middle child.
He was a typical boy. He was all boy, very busy, loved sports, loved soccer.
You know, if you can read about, you know, his accolades. There's a, you know, team captain, leading goal scorer, started varsity as a freshman. This might have been the beginning of his challenges and his problems, because Chris suffered an awful lot of broken bones growing up. What's unfortunate is back then, when you got injured, they prescribed you painkillers.
The trouble didn't start till college. And when he started having issues, he hooked up with Amy.
You know, he was sober for months, and then all of a sudden we got the classic 1:43 a.m. Friday, July 13th, phone call in the middle of the night. And, you know, something that you never forget. How do we get here, right? How do we get to Chris's corner? There's no greatest devastation that you could suffer than the loss of a child. I was talking to Amy shortly afterwards, and I just said, you know, I got to do something with this pain. I got to make a positive out of this pain. I said, I really would like to help the people in the community, those in recovery, those are trying to recover. And then she ended up hooking up with the Joseph
Mr. Early.
right, and the Department of Justice and everybody else, and they put in a federal grant. The grant came through, and here we are.
So I'm Amy Leone. I am the owner of Community Impact. The former police chief, Tom O'Laughlin, and myself, we worked on implementing the Regional Substance Navigation Program. And what it was that we respond to every overdose that happens in the community, and we respond to the hospitals with the detectives, and also provide those individuals and their families any type of support that they need. So that kind of evolved into knowing that, okay, we can give all of these people these services, and we can respond, and we can do all of this, but we have no place for them to go once they are released from whatever that program is. So that's where the evolution of Chris's Corner came from. And so this is where the Recovery Resource Center was kind of born as the next initiative of what this community needed. When you look at the array of resources that we have, we really look at it from an eclectic perspective. We have a lot of different avenues of recovery and getting back on your feet. We look at the person, they may have a struggle, but we're looking at the whole person, not just what that struggle is. And we're really looking at helping individuals as a whole, not just their drug addiction, their homelessness, mental health. That's just a piece of who they are. That isn't who that person is. We have a lot of community events, we do groups, we do workshops, and it's basically for everyone. We've done things for people specifically in recovery, we've done book clubs, we've done kids' worry groups, basically yoga, meditation, like energy, movement. So it's a lot of skill-based things. It's life skills.
So I think a lot of the groups are so important for people in recovery, especially during this pandemic, because everybody's been so isolated. So I think the groups have been amazing, and just being there and having other people who are going through the same thing is so important.
To bring the communities together and for the outside world to understand that the recovery community, they're just the same as everybody else. Like, I don't want anybody to think that they're ever alone, because they're not. There are so many people out there who are struggling, and for years I hid that. But it's just, no one should be alone doing it.
People at Chris's Corner, we all care so deeply about our job, and a lot of us have been touched one way or another by substance abuse. And so I think just the availability that our staff has made available to the clients in the community of just, okay, if you're ready, like, we're here, you don't have to wait. Okay, we have resources to help you with whatever you're going through, whether it's mental health, whether it's substance abuse, whether it's therapy, whether it's a family-related issue.
One thing that sets Chris's Corner aside from probably other recovery centers is that we have case management, we have recovery coaches, and we have mental health counselors that are here to be able to provide those short-term supports. Whether it's, Renee picking up food from Salvation Army and bringing it to some of the homeless, or having it here for them, or somebody needing clothes and all of, Brittany getting those together, so it's really from a holistic perspective, like you said, that we're able to help where that person is.
We get started really back in 2015. It all started when we started taking a different approach to the opioid crisis, and understanding that it was a very complex disease of the brain and not a moral failing or a character flaw, which led us to start looking for grants because we saw the number of people that were dying every year. And as we saw it continue to multiply, we saw a perfect ally in Chris's corner in terms of providing services, helping steer people towards treatment rather than a jail cell. And it was a natural fit with the Milford Police and Amy Leone, because they were ahead of the curve on so many things, doing so much good work down here, that we figured we could improve on that by partnering, getting some federal funding, and coming out with this federal grant.
Milford Police, we've been involved with Amy Leone going back, close to 20 years under Chief O'Loughlin. We've always had diversion programs, whether it's formal or informal. We try to keep, children out of the courts, certainly out of jails. In the event there's any issues in there, we can work with the parents and talk to the parents and see if whatever behavior is going on. And we have outreach through Amy's office, and anything informal we can do. We work closely with the Milford Youth Center. I have officers assigned over there for after-hour programs. We're not just there when there's a problem. We try to be there just so they can reach out and get to know the police officers on a more informal basis, more friendly before bad things happen. It's kind of a community policing approach that we've had in this department, in this town, for a very long time. Our department was probably one of the first departments in the state to train officers in carrying Narcan. We were definitely ahead of the curve on that. We have saved lots of lives in this community.
If you ask the chief or anyone in law enforcement 25 years ago, did you think your officers, or how about the district attorney, would be carrying around Narcan? Because there's just the chance of saving someone's life every day. And I'm sure the answer would have been no. But now you take this now, and it really is a lifesaver. So the nice thing about this partnership is you've got the district attorney's office, the Milford Police Department, and Chris's corner all coming together out of Chris's death, out of a tragedy, coming together to provide the most up-to-date, clinically proven, evidence-based way to fight this horrible disease. Last year we lost 93,000 people during the pandemic to this disease. And I think everyone understands we've got to do better. And that's what I think everyone working together down here does.
I think that the community has really embraced the fact that when we see a need for change, we actually follow through and do it. This is not an individual problem, a police problem, or a family problem. It's a community problem. So as a community, they've embraced that, and we were able to do that for all the regions that we work with. So every community embraced that whole philosophy.
Remember, the light at the end of someone's tunnel could be you.